And hello, everybody. Welcome back to Human Behavior in the Social Environment. Welcome, students. Today is the last lecture, and we're talking about very late adulthood and everything related to what happens at the end stage of life. What happens in that part of your life that we all know we have to face, that many times all of us know that we have loved ones who face this, and one day, of course, we will have to face it as well. Um, and we know about the death and dying process today. Um, this, was discussed by Elizabeth Kubler-Ross. She has a seminal book called On Death and Dying, and she wrote this book out of a lot of the work that she was doing with individuals who were at terminal stages of a very serious illness. And she worked with them on how to cope and how to deal with what was happening with them in terms of impeding loss. And she also noticed that this also happens when individuals lose a loved one, that you go through these stages of grief. So let's talk about those stages. The first stage is denial, anger, bargaining, depression, and acceptance. So in her model, she says that people individuals often experience when they're confronted with mortality, either of their own mortality or those of their loved ones. And this is a great model that was developed initially through her work, of course, with terminally ill individuals, but it has broad applicability. So it can be used in understanding how people cope with any type of a loss, right? We talked about earlier in class today about the various different types of loss that someone can experience and how that can impact and cause a major life change, a change in their life that's pretty significant. Um, so these are things that people go through late in adulthood, right? Usually. And denial. So Kubler-Ross mentions denial. That is sort of the initial defense mechanism that happens right at the onset of a loss. Individuals are in a sense of denial because sometimes it's way too painful to deal with this loss that you're experiencing. And denial is almost like a temporarily, it's a healthy way of dealing with loss because it's like a disbelief. So it's in your initial defense mechanism, puts you in a state of denial, and it allows you time to sort of absorb what's happening. It could be very shocking and distressing news that many of us receive when we hear something that we have to sort of accept. So that was Kubler-Ross's experience in working with this population of death and dying, that there was this sense of denial. The next one was anger. And anger really, for her, reflects this frustration and helplessness of the whole situation, recognizing sometimes things are unfair. Sometimes you lose people. They could be walking around healthy 1 minute, and the next minute you've lost them. And, it feels very unfair. And you have to recognize the unfairness of the situation. And, we'll talk later on about how sometimes anger that you have about the situation sometimes can be placed on other people. So that also happens with a lot of individuals, that this anger is hard and it's part of frustration. The next one was bargaining. And I think that this is people's attempt to regain some sense of control because, in a sense, if you are given a diagnosis of a terminal illness or someone close to you is given a diagnosis, things can seem out of control. So sometimes bargaining can represent an attempt to regain this control by, renegotiating and making concessions. And oftentimes this involves a higher power. If only this could happen, I would love for these things to happen. This bargaining process. There's a deep sense of sadness and depression that's normal when you've lost someone. Normal. This depression sort of acknowledges the loss and its effects. So it can lead to sadness. And sometimes the depression is a time for reflection. You start to be sad. You start to really think about things and sort things out in your head. It's a time for you to reflect. And I think finally, acceptance is what happens when it's sort of a peaceful acknowledgement that this is the reality of things. And I think it helps with this acceptance to move forward. Kubler-Ross's model, I think, really talks about the importance of emotional well-being and the need for support systems and navigating complexities of life in this emotional landscape of aging and end of life. So Ira Brock comes around and he builds on what Kubler-Ross speaks about, but he emphasizes 4 tasks for those individuals who are nearing death. And those tasks serve really as a way of guiding. So if you're a social worker and you are working with someone in a hospital setting, or maybe even in hospice setting, any sort of palliative care, you can ask these questions, these profound questions, that are typically happening during the death process. And part of it is like, who do you need to forgive? Who important to you do you wish to receive forgiveness from? So it's the reconciliation. It's reaching out to people and saying your last goodbyes to someone, tightening up, buttoning up the end, the missing pieces, lingering resentments of guilt. And that's included in what he's saying, saying goodbye is also like expressing gratitude and acknowledging for things that you that you appreciate about the other person. I think also saying I love you, it's to the people who are important to you. It's recognizing and affirming the deep bonds between these individuals. And this helps in the dying process. You feel that things, nothing is left unsaid. And it's a treat. I really do think that it is a treat to be in the position where you can say your final goodbyes to somebody, because so many of us aren't able to say goodbye because sometimes you lose somebody and it's sudden. And you don't have a chance to, to get those moments back that are important. Okay. Saying goodbye is, it's important in the context of impeding death, but I think that I like this Ira Baya. I kind of feel like, why should we do this when we're on the brink of passing? Why should we take these last moments before someone passes to have these conversations? I kind of feel like we need to have these conversations before we're sick, before we pass on. You need to have these important conversations instead of in the context of impeding death. We should have these conversations with people in everyday life. Oh, I think. Saying goodbye. We talked a little bit about advance directives earlier, but advance directives, they're legal documents. Let's see, Emily, you mentioned advance directives, that you do some of those. Do you want to talk to us a little bit about?
You just put people in the door. Well, I don't fill them out with members, but we do discuss them and the importance of them, and that doesn't mean necessarily that you're giving up on life, that you are saying that, things are over, I'm old, I'm dead. It's really just being ready. So if something does happen, or you do get to that point, people know what you want, that you have a say when you are still capable of making those decisions. Because if not, things happen when they're made in an emotional state.
Yeah, and I don't think I don't think it's out of the question to have advanced directives even when you're living, or even creating a living will. I taught this class, oh gosh, I want to say, maybe 5 or 6 years ago. I taught this class, and that was an assignment at the end of the class. Like, you all put your wishes on paper, clarify everything that you would want to happen to you, your healthcare wishes, so that anybody seeking to have a say in what will happen to you, because we all know we're going to be at this moment. We all know it's going to happen to everybody. Make your wishes explicit and directly, because what happens if you're at a point where you're not able to communicate your wishes? Then it's left up to family members trying to figure out what you would have wanted. So it's so important, to kind of think of this, because you never know what could be happening. And advanced directives outlines the specifics concerning your healthcare interventions, or no interventions if you want. So advanced directive serves a dual purpose. So first, they offer a good voice, your voice at the end of care, ensuring that some of the treatments align to the values and wishes. And it also alleviates this decision-making burden on family members and healthcare providers. And it reduces conflict, because y'all know, end of life decisions, and you got family members coming together, and people barely know each other or like each other. And there's all of these past issues that spring up, and confusion can happen making decisions for loved ones. And I mean, it can get really ugly, and families can fall apart. If only Big Mama had put it into words what she wanted, made her wishes clear. A lot of families are torn apart. And I think that this is clearly one way of creating some harmony, because it's hard enough, terminal illnesses and comfort care. Advanced directives clearly clarify someone's preferences. And you want to promote autonomy as social workers. At the end of life decisions, you want people to be in control of what happens to them. And this is a real practical approach to managing end of life care decisions. And I think it helps deal with, think about Kubler-Ross, and think about the stages of Death and Dying by Ira Byock. It's important to round out and to not complicate the grieving process by getting people psychologically and emotionally ready for end of life decisions. So it just helps, because you need to face mortality with dignity and with intention. So the passage of the Patient Self-Determination Act in 1990, all this really says is that in healthcare, personal autonomy and informed consent in medical decisions. There's a law that requires healthcare providers to inform patients of their rights to make advance directives in state law. This is legal documentation, and is central to the concept of advance directives. And part of it is a living will. This is a written document where people can specify the kinds of medical treatment they want and they wish to be withheld. Like, what happens if you're incapacitated? What happens if you're brain dead? Do you want me to keep you alive? What happens? Under what circumstances can we pull the plug, right? You outline these things. Remember, you're doing this not for you necessarily. Part of it is for you, but also part of it is for the caregivers who come along and got to try to figure out what's going on. So you outline these things carefully. A living will helps to ensure that medical care aligns with what the patient wants, and situations where they're not able to communicate and make decisions on their own, a durable power of attorney for healthcare. I do a lot of those in my practice. And, this says, I'm not making decisions in my health. I'm going to designate someone else, an appointed person, somebody you trust, a family member, a friend, somebody you trust, who has the authority to speak for you and make decisions for you and adhere to what you want. So this has to be somebody very close to you who you know and trust will, in case you become incapacitated, this is the person that's going to make decisions for you. I love this. Y'all look at this. Gina, thank you for this comment. You tell people you love them now. Life is too short. I have advanced directives completed. Yes, Gina, you are making things so much easier for your family. And irrevocable trust. Yes, 66 years old. I am 60 years old and a nursing practitioner. So she knows firsthand what's going on. I'm in great health now, but you've seen so many people who do not have the proper documentation. She's an administrator. She deals with this every day. She probably is jumping up and down because you all need to know that these things need to be in place. And so many people are scared to talk about death. And that's what stops them from wanting to even have something like this in place. But you really need to have these things in place. And it's a sad situation when things are kind of crazy. And even having a trust, you don't want your possessions to go through probate court and you have to pay all those fees and everything. You just want to be able to know that you can die peacefully and understand that your family is taken care of in the way that you want them to be taken care of. Thank you, Gina, for that comment. That was great. Okay. Care for people who are dying. Yeah, palliative care, it's like a big umbrella. It's a beacon of giving support within the healthcare continuum. There's a continuum of care. It's basically used for people who are facing serious illnesses, and it's an active form of care, but it focuses more on making the patient comfortable, managing pain, managing symptoms, rather than trying to cure the disease, because when it gets to the point where it's terminal and we know that you're not going to get better, we just want to increase your quality of life, then you go into palliative care. And that's a team of people who work with you to try to make sure that you're comfortable. You get support, and the person's values and wishes are implemented. And this is a palliative care team. They work together across disciplines, social workers and everything. They just try to endure and make sure that you have dignity and respect for end of life. Patient-centered, patient-centered care, very comprehensive. But hospice is what happens when you receive a medical prognosis of 6 months or less. Now, people are in hospice sometimes longer than 6 months, but a physician monitors you on a sometimes daily basis, but definitely on a regular basis. They monitor you to see how you're progressing, and if they know that you're not going to get better, very unlikely, and you got 6 months to live, then you'll be placed in hospice care. And so it's kind of a subset of palliative care. And you definitely, those people who are at the final stages of a terminal illness, I'm talking, end stages of cancer and heart disease, a lot of dementia, Alzheimer's, because they can't get better because they don't remember. So it's hard for them, to progress, and that they start declining. So hospice care is appropriate for people in that category. And you're just no longer going to pursue treatment. We're not interested in curing the illness at this point, you shift your focus to a comprehensive symptom management. You are received emotional support, spiritual care. That we have I work for a hospice, have a contract with a hospice company, and we have a pastor who comes and he gives spiritual care and emotional support tailored to the unique needs of the patient. And you want people to face the end of life with dignity. And I wish more people of color would use this option. I just think it's underused in a lot of different ways. So I wish it was, I wish there was more knowledge and acceptance and use in our community for hospice care. Key ideas of hospice. Again, they care for your physical symptoms, your biopsychosocial, spiritual needs of the patient, but also the loved ones, like the caregivers who are caring for people at the end of life. They need help and support too. Care is delivered. There's an interdisciplinary team. I know in my hospice company, we meet as a team, interdisciplinary team. We meet on a regular basis to track and monitor the situation with the patients. There's a physician, there's a skilled nurse, there's a nursing aide, there's me, myself as a social worker, there's a member from the clergy, there's volunteers, there's anybody who is, part of doing care for the patient comes together, and we talk about things. What's happening, to make sure that we're providing comfort. And also, hospice services also provide bereavement. So there's an entire team of people who look at, it's not just when you pass away and then we forget about you. We do reach out to you, and we also offer bereavement services, to support the family. It's a critical part in hospice philosophy, is to provide care even afterwards, and you're eligible for it. Also, I want to say with hospice, there's a lot more funding that comes from hospice. So, you get all of our patients on hospice get free diapers, free wipes, free, a lot of free things you get because you're under that hospice care, and it's paid for by your insurance. So that's another reason why it's so important to be able to recognize and to get on hospice, as quickly as possible to make sure you get those services. Yeah. What are the signs and symptoms of the dying process, impeding death? So all of these signs and symptoms, we monitor this consistently. So we're always looking at your temperature. We always look to see if the person is cold to the touch. Sometimes the color of your skin changes when you're at the end because blood doesn't circulate as well. Sleep, we do a lot to monitor sleep. So social workers and nurses, we're always asking about how long did they sleep. And typically when you're coming to the end of life, you sleep more. So sometimes it would be like 14 hours. They're sleeping 12 to 14 hours a day. That lets us know that the person is in the process of dying. And the process of dying. Sometimes the secretions in the mouth, y'all know about the gurgling, the death rattle. Part of that is because there's secretions in the mouth that are released. And when you're at the end of life, it's hard to swallow. So you just have like fluid in your mouth. And so you make that gurgling. They call it a death rattle. That's kind of what it's called. We know it's coming soon. Incontinence, of course, muscles in the body just relax. You're in the dying stages and you have no control over the bladder, and your bowels could be lost. That's normal, very normal in that unusual situation. A lot of restlessness and confusion. Yeah, lots of confusion. So patients really do experience this agitation and restlessness. And we do give, like the doctor, if the doctor hears about this kind of restlessness and agitation, the doctor can prescribe like Risperdal or something to the patient so that they can relax and calm down, so they're not look so anxious and confused. What else? Oh, you're not going to want to eat. People who are in the stages of dying won't want to eat or drink anything. They have a difficult time swallowing. So, I was working with a loved one who was like, he hasn't eaten in a couple of days. I think I should give him some food. But when I gave him food, I noticed he wasn't swallowing, he wasn't chewing. And I was like, well, he's probably not hungry. He probably doesn't want food. And he didn't have a lot of liquids. They don't want, you're not going to be hungry during those moments, or days or weeks sometimes following when the death and dying process is happening. You're not going to want. So we spend a lot of time as social workers educating loved ones. This is what we do as social workers. We educate loved ones on that process. Well, this is the normal process. You are going to see a decrease in appetite, a decrease in, wanting liquids, because it's very difficult to swallow. Breathing becomes irregular. Interrupted breathing sometimes may change. It could be real shallow breathing or sometimes rapid breathing. So that's another thing that we monitor. And increased signs of pain is sometimes it's very difficult to know if a patient is in pain, but not everybody experiences that. But you could have some discomfort and increased pain right at the end stages. And it's hard to know because the person can't really tell you, but you can see if they're grimacing or if they're kind of like, get kind of restricted. You can tell that they're probably in some type of pain. I just want to say, like in hospice care, we monitor this stuff very closely. And if you get better, so weight loss is very common, but if you start gaining a lot of weight, you were sleeping 8 hours, you were sleeping 14 hours a day, and now you're sleeping, 8 hours a day, and you start getting better, you get off hospice, right? So hospice is just for the decline process. So there have been people who've gotten better on hospice, not normally, but sometimes they get better and they're not on hospice anymore. They come out of it. And then some people end up coming back on hospice. So it's really strictly for the dying process. And these are the things that we monitor to make sure that, just to kind of monitor to see about the dying process. Yeah, signs that death has occurred. Well, there's no breathing, no rise. They look at the chest to see if the chest is rising and falling. Your heart stops beating, so you look at the pulse, you take a pulse, and it could be checked by a professional. There's no pulse, no signs. A stethoscope, or listen to a stethoscope. You lose control of your bowels. The muscles are completely relaxed at that point. You're not there. No verbal response. Individual, you make a loud noise, like a boom, a loud noise, the person's not going to respond to a loud noise. Or sometimes they'll call the person by their name. Hey, they'll call you by your name. And if you don't respond to your name or anything, then we know that death has occurred. Eyelids aren't necessarily closed. Sometimes they might be open, but just staring off, fixated into something, that lets you know also, or have a glassy appearance to the eye. The mouth will fall open because, slightly open sometimes. So I think that, discussing death openly with family members, it's sometimes tough and difficult to do, but as social workers, it's important if we work in this area, and considering this is the fastest growing population, chances are as social workers, you will come across this, right? Because this population is a huge segment of our population, and this will happen to you. But, being comfortable yourself by talking to family members, because what happens is that you educate them on what's normal about the death and dying process, and then you could see it kind of alleviates some of their anxieties because they don't deal with this all the time, and the fear of the unknown is possible. So you want to make sure that the person who's transitioning is comforted. You want to make sure that their family is informed and supported. As social workers, you want to make sure that these crucial final moments is something that is not as tragic as it can be, the final moments of caregiving. And I think this dialogue between the social worker and the family members can provide a sense of closure, help them get ready for what's coming next, and can ease this emotional burden that happens during times that are very challenging for many, many people. There are stages of grief. It's before I go into the stages, because stages sounds like you go from one stage to the next stage to this stage. It's like you go in order. I just want to say you can be in any order in any point of these so-called stages. It's just moments in time. Sometimes you may feel like you're going backwards, but no, you're still progressing forward. So I just want to say that grieving the loss of a lost loved one, it's so deeply personal. It's very complex. It's characterized a lot of times by these emotions, of those left behind experience. And so I think even with that in mind, we can still go through these stages because it can let you know that, okay, this is normal. It's a natural response to loss that everybody experiences. This cuts through culture. Everybody experiences this, right? So typical stages of grief is this disbelief, denial. It's like, feelings of, I can't believe this is happening. It's challenging sometimes to accept the reality of a loss of a loved one. And this stage is usually shock, denial. Individuals may feel numb. They may find themselves experiencing decreased, wanting the person who's passed on to come back. You yearn for that person, especially if they're really close to you. You yearn for them. And so there's this disbelief that serves as, again, emotional defense mechanism that allows you to gradually absorb and accept the loss. And you do it at your own pace. Everybody has their own pace. I do want to make that point because I think we do a lot of judging of other people and how they process loss, and that we don't understand people do these things at their own pace. Everybody just has their own unique way of dealing with these things. Painful and disorganizing reactions. Yeah, when the shock wears off, it is replaced by suffering. That's the sadness. This stage is usually intense emotions, sadness, anger, guilt, sometimes regret. So individuals can also experience physical symptoms during this painful part. You could have problems sleeping, problems eating, can't concentrate. It's a very tumultuous time for a lot of people who are grasping with this reality of losing someone close to them and the implications and the changes that it has in your own life. This getting over state, I don't know if anyone ever really gets over a loss of someone close to you like this complex loss, but it's a term that's used to kind of help with this grieving process. I think instead of saying getting over, we probably should say you need to adjust. You need to reorganize your life in a way that feels better. So in this stage, people, you have to find a way to connect with the person that you've lost, and also learn to live in the world without your loved one. And if sometimes you want to disconnect with the world, go into yourself so that you can process everything and gain some insights. And then slowly you can start engaging yourself in social activities, and you will find a resurgence of energy, and you can start planning for your own future at that point. But initially, you have to start kind of like setting yourself up again. And it is important to grieve, to allow yourself this grieving, and to know that grief can resurge even after you feel like it's over. You say, oh, I've made a significant process, I'm over that. Sometimes you can be triggered. I know a lot of clients that I work with, they're like, okay, the anniversary of this person who died, who was close to me, the anniversary is coming up. And sometimes that can trigger the grief process again. You have memories of them, certain smells or sounds or music or movies, memories get triggered. And sometimes you can start all over again. You can be in disbelief and go through the pain and all of that again. And that's normal. It is okay. We as social workers need to educate people of this, but you need to know that these things are okay. Eric. So Eric Lindemann came along and he gives his own version of this, right? Shock and disbelief. He, his model talks about the mourning process. He says that shock and belief, of course, is normal. And there's a acute mourning. So during this stage, it's the full impact of the loss. It's deeply felt. Grievers may experience a wide range of intense emotions during this time: sadness, guilt, a period of longing for the person, but there's a resolution, right? So all of these stages kind of follow the same format. There's a resolution. You reorganize your role according to him. You make accommodations for the absence of your loved ones. The pain of the loss, he points out that the pain of the loss may still be there. The intense emotions may be there, but sometimes they were lessened, and it allows the bereaved to engage again. So that's what resolution is for him. We went through Kubler-Ross, her stages earlier, where it's this profound impact on understanding the loss process. Now, Therese Randall, she comes by and she has another sort of nuanced perspective of grieving. She emphasizes the cyclical nature of the process rather than a linear process. So Randall talks about 3 major phases of grieving that individuals typically cycle through, and she terms it as avoidance. So this initial phase, you engage in a psychological retreat from the reality. It mirrors denial, of course, and it allows people the process of letting it all soak in at their own pace in a way where they can handle the emotion, because you want to avoid. Actually, avoidance is really great. You don't want to live in avoidance. You don't want to live in denial. But being in denial and avoidance and isolation, all of that, that's so normal. And you have to allow yourself that. But you will eventually have to. And I think that's why going to funerals is very helpful. Funerals are really good for those who have lost loved ones, because it helps with the grieving process. So eventually, at your own pace of what you can handle emotionally, that's what you start to open up. And then you get to the point where you can confront things. That's the heart of the grieving process for Therese. Individuals have to face the full reality and magnitude of the loss. And it's emotional. And she believes that as social workers, we can help people work through their pain and their grief, acknowledge and experience the depth of their emotions. And this phase is very crucial in the heart of the healing process for her, confronting the pain directly. That's how you move forward. And she's saying you cannot skip this process. You have got to confront it in order to get through it. Okay. Making accommodations for Therese is people start to adjust to life without the deceased. And this phase really, you reorganize your life, you start to adjust. The pain of the loss might still be present though, right? But it becomes integrated into your life. Part of this loss process, I just want to just see how y'all doing. But part of this loss process is that I work with patients. Part of the loss process, and people from the class can talk about this as well, is you have to say goodbye to who you were. You're not the same person anymore. And I think that's the hardest thing when I work with a lot of my clients who are suffering with this, with loss and grieving and bereavement treatment, is that they're like, not only are you mourning the loss of this person, but you are a different person because you've lost this person. So part of it is just getting to know yourself again. You know, sometimes that is very difficult to do. Like, who am I now? Like, what am I? I'm now a widow. I wasn't a widow. Or now on Mother's Day, I don't have a mother to celebrate Mother's Day with. Now I'm someone who is not doing these things that I used to do. So you're just a different person. So I just want to add that in. Are there any questions from the class? This is the last week of class. Y'all are probably like, okay, let's get through this. We can go on to the task of mourning. William Worden, he comes along and he says, okay, he worked in grief counseling. And so he's saying, okay, we got to go to an action-oriented framework. And he talks about tasks of mourning. And he believes that effective mourning requires the bereaved person to actively engage in tasks that will facilitate healing. And many of the tasks, he says, help to confront their grief, but take deliberate steps toward adjusting and accepting. So some of those tasks is just accepting the reality of the loss. This involves acknowledging intellectually and emotionally the loss that's occurred, and realizing that this person will never come back again in that form. I don't know. I think you can have connections with people on the other side. Maybe that's just me. What do y'all think? Y'all think you can connect with people on the other side? People from the class. Journey. What do you think about that?
Yeah, I do think you can connect with people from the other side. I was actually just telling a client of mine this Wednesday. Her son passed away maybe a year or so ago, and she just found out some news about her son. And conveniently that day, she had seen a Facebook post. Like, a friend had shared a Facebook post about him, and I was like, that's too big of a coincidence for you to not say that's him looking out for you, that it popped up on that day.
That's amazing. That's an amazing story. Great illustration. I think all of us have stories. I got a ton of stories like that, where I'm like, okay, I know this person is connecting with me from the other side. Thank you for sharing. That was great share. Yeah. So yes, you have to deal with the fact that that person is not coming back in that form, but there's other ways to connect with someone. So you do need to deal with that. But he's like, I don't think Worden believes in woo-woo stuff. But anyway, you have to process the pain of the grief, of course. He emphasizes there's pain associated with the loss, and you can't skip this, right? He encourages people to experience the grief fully. No more avoiding, no more suppressing your emotions. And we talked about this last week. What do these men do when they lose their wives? The first thing they do is go marry somebody, go get married right away. We talked about who gonna make them a sandwich. Men are more likely to deeply mourn the loss of their spouse, more so than women do, but they're faster to remarry because they're not listening to Worden. Worden is saying you have to work through it, you have to deal with it head on, finding new ways to adjust and live in the life with the person. So that's what he talks about. connecting with somebody. Let's see what else. You do need to find a connection to move forward. A balance. There's a balance between remembering the loss, the person that you love that's lost, and honoring them in a way where you can honor their memory in a way where you can still continue to live your life, right? So that's wardens, adjusting to the environment, navigating things. Sometimes things can be very turbulent, in which the deceased is missing. So, adjusting to an environment that's devoid of the person that you've lost, filling roles previously occupied by the deceased, right? In order to do that, you have to be resilient. You have to be able to adapt. And so he believes we need to be pushed forward, new way of identifying and new capacities. Let's see. Coping with loss. So the process of coping with loss transcend the initial stages of grief, right? It's venturing, a little deeper into how you evaluate and look at your own personal reactions to bereavement. I think that the nature of loss significantly influences the coping strategies, right? Adapted by the grieving individual. So what's your go-to when you're coping with something stressful in general? Chances are, these things can happen. I can't tell you about how many people I know personally and how this has happened for a lot of people. They just say, you know what, that first year I lost, or first 2 or 3 years of that loss of a loved one was so devastating that I just sat on the couch and ate for a whole year and gained all this weight. That was their way of coping with what was happening, and your loss and dealing with your loss. So many people have so many different ways of coping with loss. So it is, looking at that, because a lot of it is shaped by a person and environment encounter. What is the support system there, the physical surroundings? What are societal norms about mourning? They all play a critical role in the grieving process. Minimizing some of the negative emotions following the loss is critical, I think, for maintaining functionality, I guess, in areas of personal importance, but you still need to set aside time to process those negative emotions. But some of us have to go back to work. Some of us still have to parent. Some of us still have to continue on, but allowing yourself that space to really grieve. I know in my doctoral program, there was a cohort member of mine. She had lost her grandmother during the PhD program. She had gone to the funeral and come back, but it wasn't until the semester was over and she was so inundated with all of the areas in her life, personal areas that she had to get through. She was so inundated by what she was doing from day to day. She never had a chance to grieve. And she's like, oh my, she called me on the phone. She's like, girl, my grandma died a couple of months ago, but now that the semester's over and I'm left, I turned my assignments in and I'm left with everything. Now all of a sudden I can't stop crying. She just started allowed herself in that moment to really grieve, but she couldn't do it right then because she was trying to get through the semester and it was a lot on her. And PhD programs don't be caring about your grandmama. They want to put you through the fire, so to speak. So you go through that, but her grief process wasn't until later. And she's like, here I am crying like this, so that happens sometimes. Humor. Lord, what do I say about that? Have any of y'all seen this viral post with these two ladies? And they are these two ladies are doing a video, and they had lost their sisters. They did a video, they had lost their mother, and they did a video, it went viral, on all of the things that's happened since their mom died. So they were doing a hypothetical video to their mother, and they're saying, hey mom, this is your two daughters, it's been a year since you passed, we want to give you an update on how we've been doing since you've gone. And it's a beautiful video on it, and they're just like, let me tell you, I did not know that I need to file your taxes, even though you've passed on. And they're just laughing about it. And they're, they have this appropriate sense of humor, I think, because they were like, I didn't realize that I now needed to get my own car insurance. I was driving for 9 months without car insurance. And I want to let you know that so-and-so had her baby. And they were just giving this video response to their mom. And I think it was just a really beautiful, humorous. They were sitting there laughing. It's a very tragic thing. Their mom just passed a year ago, but they were able to introduce some humor in appropriate ways, right? Yeah, but traumatic loss is different than normal grieving. Like, it's a privilege to be able to lose somebody in hospice, but sometimes it's traumatic. It's sudden. It happens right away. And I think it's important to vocalize your thoughts and feelings is so important. This act just really is a release valve to kind of like talk about the emotional pressure that a lot of people are under when you lose somebody unexpectedly, and spending a lot of time validating people's feelings in that moment, I think, is unique. Cultural expectations. Yeah, a lot of the grieving process is cultural, and kind of distinguishing between the individualistic approach. So we live in a world or a country, United States, is typically the dominant society is individualistic. So sometimes in the people who ascribe to the dominant whiteness, that's whiteness, by the way, individualistic culture, they're going to grieve differently than somebody who's in more of a collective, community-like culture. So you have to, as a social worker, you need to assess what's appropriate. We talked about that earlier. What's appropriate? So if we talked earlier about the second generation Irish Catholic individual, they're going to want to prioritize individualism. So they may want to cope with the death and dying process on their own, sometimes just navigating their own sorrows on their own. Where a more communal, collective community, they believe in doing acts of mourning that's shared among family members and community members. And so you have to be respectful of that. And, I think we need to keep this in mind because, and y'all can tell me what you think. I see so many families fall apart. I think I must remove this. Well, and I can open this up to the class. I see so many, I don't know what y'all think in the chat and people who are watching. I see so many families fall apart after Big Mama dies or the head patriarch in the family. As soon as they pass on, things just can get very chaotic. People can be very judgmental to others because they're not grieving, they're not acting and doing things in the way that another person thinks is appropriate. And I think that let this be an opportunity to have grace and compassion for the fact that people are really struggling and everyone has their own unique ways. Yeah, some of it is cultural and some of it is personality and some of it is the dynamics of the relationship. And I think that we need to think seriously about how we judge other people for behaving and for acting in ways that's not adhering to what you think they should behave and act. And I think that it's, it can be emotionally driven, this whole process, and feelings and thoughts and everything can escalate. I don't know. Anybody from the class want to comment on that? the grieving process and how people sometimes don't want to.
I feel like our family, like my extended family, has experienced a total, well, essentially fall apart because of loss. But I think part of it has been misdirected anger at the people who've lost. They needed somebody to blame, so then they just start picking at other people about nothing. And then sometimes it's about money and
possession.
Like it's just a bunch of feelings that they didn't know how to deal with their feelings before, and now they've been given these giant, big feelings that they have no clue how to deal with.
Yeah, and it can break people. I mean, like, I'm never speaking. Even in my own family, my mom with her brother, she's like, I ain't speaking to that man ever again, you know. And she's just, I mean, it's deep seated. Some of the stuff is very deep seated, and yeah, it's a very real thing. So it's important to make your wishes very clear, especially when it comes to finances and money and what to do with the things. The clearer you make things are, the nicer family members sometimes can be, but sometimes it's just like people get real snappy and snippy, and they're irritable, they're not in a good mood, they have these expectations, and you work with people to help them to come around. Anybody else comment on that? Anybody in the chat want to comment? We got people tuned in. Diversity of expression of grief. Allow it to happen. Give yourself grace. Okay. Oh, wait. Here we go. Working with older adults. Yeah, you got to somehow take into consideration the existing person's life story. So when you're working with older adults, that should be taken into consideration. You need to develop a self-awareness of your own views on aging. Hopefully, if there is, what is somebody writing in the chat? Death and marriage have interesting emotion impact. Dr. Vibe. Death and marriage. Oh, so those are two major transitions in someone's life. Can have an interesting emotion, and it impacts a lot of people. Yeah, in many ways it can. You would think that marriage would be a joyous situation, and sometimes it's not. And you would think that death would be something that would be a little more easy, and sometimes it's very difficult to work through. Yeah, thank you. So anyway, let's get back to working with older adults. Yeah, I think you have to look at it in terms of comprehensive approach and weaving some of these things together. Empathy is important, and respect for the individual's life history. I think that's essential for social workers to develop also a sense of self-awareness, your own views about aging, and challenge some existing stereotypes or biases you may have to people who are older. Sometimes they don't hear very well. Sometimes they repeat themselves a lot. So it takes a lot of patience, and a lot of checking in and making sure that they're not a burden. We just want to hear them and understanding their unique stories that shape who and what they are, their life. It can illuminate for you sometimes the older adults, their needs, their fears, their hopes, and it can help you give them more personalized and effective support. I just tell you, there's a guy in hospice now that I'm working with. He was a musician. He was classically trained musician, and I have my flute, and I'll come and visit him, and I won't say much to him. I'll just come and I'll just play my flute and just play some songs that he recognizes, and And that's it, and he's like, thank you, I appreciate you coming. So I listen, to his story, and it provides him a lot of comfort, which is so important. Let me see what the next. Okay, so when working with older adults, and getting their story and working with them, I think it's also important to understand the retirement process. What was retirement like for you? Sometimes people were pushed out of the working environment into retirement. Sometimes people were they left on their own, and sometimes they were pushed out. So the retirement process, getting a picture of that would be really nice, because that is a significant transition. And because a lot of individuals, our identity is tied to what we do, our daily routines, our social networks sometimes is so closely related to some of the things that you do for a living, right? And so sometimes when retirement happens, that's another sense of loss, right? You can help older adults find new resources for fulfilling their lives and purpose. Assessing some of the networks, natural networks. Another thing to keep in mind is sometimes being in institutions, right? So how to put another significant transition is when older adults need to be moved. I know, Emily, your grandmother doesn't want to be moved, but she may at one point need to move from Ohio, right? So, social workers are involved in that transition. Sometimes they transition to an assisted living, from an assisted living to a nursing home. They're in their own home, and then sometimes they do need to go into more long-term care. And it's a very complex task. And Emily, rightfully so, you need to be sensitive to the emotional and psychological impacts of those transitions that is coming down the pipeline for your grandma, right? So this understanding, you can match this up with practical knowledge and letting them know their options, levels of care that's provided in a way where they can still maintain their dignity of life, of course. Let's see what else. As a social worker, you're working with older adults, engaging them holistically, right? Considering their past, their future, present, respecting their rights for autonomy and dignity throughout the whole process. You also need to assess formal and informal support systems, and helping them make their decisions. Empowerment. I mean, empowerment is a big one. Empowerment helps them foster a sense of autonomy and respect. So that's the big key thing with working with older adults. Spirituality, it often plays a very fundamental role in the lives of older adults. Spirituality assessments can really reveal some resources of comfort for older adults. Definitely when I came in and I played those hymns for the gentleman, I was playing religious hymns. He loves that kind of stuff, right? Incorporating that. Loneliness and isolation. Oh my gosh. I do think, addressing some of that. It's the emotional health. We know that as more older adults are living alone, that all this big thing with loneliness, we talked about that last week, particularly with COVID-19, getting them connected with resources, acknowledging and respecting their unique culture to keep in mind. Your client is the best teacher. They can tell you what they need. You have to be able to listen and hear it. Okay. So this is it with the lecture part for today. We're done with class today. I'm going to end, and then I'll connect with you students to see if you have any questions. But hello, everybody, and thank you for joining us. I appreciate you being here. I will say goodbye to everybody. Goodbye, YouTube.